Today on our webinar, you'll be hearing from three speakers. Hannah Halbert is a policy liaison with Policy Matters Ohio, based in Columbus. Deborah Weinstein is the executive director of the Coalition on Human Needs, which is actually a national organization based in Washington, D.C., and we're very happy to have recently been working with the Coalition on Human Needs to release a report about the latest poverty data in Ohio, and we really appreciate Deborah's time for joining us today. Finally, you'll be hearing from Bill Sundermeyer. Bill Sundermeyer is the State Director of Advocates for Ohio's Future, and he's going to help us think a little bit more about some of the advocacy work and strategies that we can use to be really effective in impacting these topics in Ohio. We will have time for questions with our speakers at the end, but in the meantime, if you have any questions as we go along, there's a chat bar on the bottom left side of your screen, and feel free to type a question in there and just send it to everyone so we can see it, and we can try and address some of those along the way or save them for questions at the end, depending on how that works best. We will, after this webinar, be sending you an email with follow-up information, so you'll have an opportunity to download the slides to see the recording of this webinar so that you can review the information, and there will also be some follow-up materials. So all of that will go out to you probably tomorrow afternoon once the webinar is over and we get a chance to wrap it all up. So without further ado, I'm going to hand it over to our first speaker, Hannah Halbert with Policy Matters Ohio, to help us start thinking about what is the state of poverty in Ohio and what are some of the concerns that we see there. Hannah?
All right. Thanks, Gail. And thanks to Advocates for Ohio's Future, Bill, Gail, and Rebecca for bringing us all together this afternoon to talk about poverty and work. I also want to thank Debbie with Coalition on Human Needs for joining us. The Coalition's assistance and guidance through Census Week, particularly during Census Week, has been just really helpful to our state network and figuring out the census numbers at the moment that they're released. So really glad to have her join us here to talk about some of the things going on in Ohio. Like Gail said, I'm Hannah. I work on issues of workforce development, higher education, jobs, both the sort of quantity of jobs we have in Ohio and the quality of those jobs. And I do this work at Policy Matters Ohio. Policy Matters is a research institution that focuses on ways state policy can create a more vibrant, equitable, sustainable, and inclusive Ohio. So there's lots of work for us to do. And you can find all of our work, including our annual data book on the state of working Ohio and our briefs that relate to the census data I'm going to cover today on our website, policymattersohio.org. And I just want to mention in the slides, in the source citation, you may see a census table number. If you're interested in finding the data I'm covering on that slide, maybe for a different geography, for a county or a congressional district, you can pluck that table number off the slide and use that in the American Fact Finder search bars to kind of help you cut through some of the massive amount of information on the census website. So if you see that, that's what that's about, and hopefully that will help some of you find what you're looking for a little bit easier through that website. I'd also like to say, if you're looking for information like that and you just feel stuck, you could always give me an email or send me a phone call, or send me an email or give me a phone call, and I will do my best to try to help you find it, because it is a difficult website to navigate sometimes, but it has great information. Okay, so I want to cover just a few really big indicators quickly so we can move into Debbie and Bill's work too. And here we see the change in employment in Ohio over several years. And I want to note that this employment measure is different from a different survey than what we hear updated often on a monthly basis. So whenever we have new unemployment rate numbers or new job growth numbers, those numbers come from a different survey. So they won't exactly correspond, because those are actually three big surveys giving us all of those pieces of data. But what we see, and what's true across all of those surveys, is that more Ohioans are working. So here we see that the share of the population 16 and up that is employed has been increasing since the end of the recession. So in 2010, only about 56.7% of that population was working. By 2014, that had increased to 58.7%. But despite this improvement, we're still much lower than where we were when the recession started at 60.1%, and where we were almost a decade ago, back in 2005, 61% of that population working. So we're not where we should be, but more Ohioans are, in fact, working. And actually, Ohioans have also been making gains in terms of educational attainment. Here we see that more Ohioans are completing high school and more Ohioans are earning a bachelor's degree. And even though it's not shown on this slide, census numbers indicate that more Ohioans are also receiving advanced degrees and maybe a master's degree or professional level degree, and more are receiving associate's degrees. Here you can see that the share of Ohioans with at least a high school degree has increased from about 86.2% in 2006 up to 89.4% in 2014. And a similar share of Ohioans increased the completion rate of bachelor's degrees over that time, so 23.1 up to 26.6%. So this may appear like a small change. It's a few percentage points. But keep in mind that it can take thousands of additional degree holders just to move the dial a single percentage point. Here, Ohio's increased both the number finishing high school and the number getting a bachelor's degree by more than 3 percentage points, and that's just over an 8-year spread. So just in these two indicators alone, we see that more Ohioans are working, and our state workforce is actually smarter. It's making gains in formal education. So despite these gains, poverty in Ohio remains staggeringly high. Here we see that poverty for all people is really flatlined in Ohio and is flatlined at elevated levels. You can see how poverty for all increased over the recession is now essentially stuck. There was no statistically significant change in poverty in Ohio between 2013 and 2014. And if you follow the red line on this chart, you can also see how the share of children in poverty just really swelled over the recession and even into the recovery period. We saw a small dip in 2012, but the child poverty rate has essentially flatlined as well. And just for a little more context, 15.8%, that's the poverty rate for all people in Ohio, translates into more than 1.7 million people. And that includes more than 593,000 kids. Nearly 1 in 4 Ohio kids are in poverty. So the African Americans and Latinos are disproportionately locked out of the recovery. In Ohio, more than 34% of African Americans and 28% of Latinos lived in poverty in 2014. And this is vastly different. This is a vastly different share than the white non-Hispanic population that had a poverty rate of 12.2%. So what's going on here? You know, despite the fact that more Ohioans are working and the state has made real gains in education, two indicators that should suggest the poverty rate should decline, these improvements are just not translating into that real reduction in poverty. Too many Ohioans are still struggling to make ends meet. Well, part of the problem is that median income in Ohio is also stuck. Here we see that household median income in 2014 was a little more than $49,000. This also was statistically unchanged from 2013, but significantly lower than the national median of more than $53,000. Ohio's median income is 36th in a ranking of states. Given the disparate poverty rates for African Americans and Latinos in Ohio, it's probably no surprise that median income for African Americans was less than 51% that of non-Hispanic whites, and Latino median income was about 73% of that for non-Hispanic whites. So stagnant wages and high poverty rates have real impact on people's lives, and it means a real increase in need at our health and human service program providers. For example, food security in Ohio has been increasing. Food insecurity in Ohio has been increasing, even as work and education levels have also increased. Ohio was only one of 14 states that had a higher than national average rate of food insecurity. Nearly 17% of Ohio households were food insecure, meaning Food intake of one or more family members was reduced because of lack of cash or resources to purchase food. So one of the big takeaways from the Ohio Census update is that while a few indicators have improved in the past year, as they have nationally, nearly all indicators are worse than what we should expect this far into a recovery. And remember, we're more than 6 years into the official recovery period from the recession. And the gains that we've made in both education and in employment are not bringing increased wages or pulling down the poverty rate. So there's plenty of work to do. Nearly 4 out of 5 Americans will find themselves in financial crisis, so a spell of unemployment, needing to rely on public programs for the poor, living below or near the poverty line at some point in their lifetime. By the time we're 60, 3 in 5 Americans will have spent at least a year at the bottom of the income distribution. So many of our friends, neighbors, perhaps even ourselves, we will need the stability that these programs provide. These programs also help stabilize our state economy. We often discuss the impacts of poverty on families or individuals or kids, but poverty really affects the entire community. When some families can't afford the basics, others in the community may lose their customers or clients. If we want a strong state economy, then our state policies must help more people prosper. And the good news in all of this, and as Debbie will get into in her slides, is that these programs really do work. In Ohio, the federal refundable EITC and the child care tax credit alone helped on average 289,000 Ohioans, and that includes 162,000 kids, live above poverty each year from 2011 to 2013. Nationally, about 61% of food insecure families participate in one of the 3 federal food and nutrition programs. So these programs don't always receive full funding that they need to address the size and scope of the need, and sometimes the program rules overly restrict access, but the data is clear. These policies and programs change lives and protect our communities. So with that, I will turn it over to Debbie so she can give us some more of the stats on how these programs are helping and the status of some of these programs as we move into federal budget season.
Oh, thanks very much, Hannah. I hope people can hear me. And thanks to Hannah, to Gail, and to Steve for the opportunity to work together with you. These are 2 great organizations. It's our honor to have the opportunity to work with you, so thanks for that. So we provide a national perspective on some of the things that Hannah was just talking about, and we, as she mentioned, did a report cooperatively with you, so there are some Ohio statistics coming up soon, too. In the report that we put out most recently about the making use of the census poverty data, we wanted to make it quite clear that it's taking us too long to have the reductions in poverty that we really need. And so we just did a kind of an exercise here. We were saying at the national level there was a 0.3 percentage point drop from 2013 to 2014. Well, if that continued year after year, no change, just at that same rate, and let's be honest, that's very unrealistic and optimistic because we have recessions and downturns during that period, which tend to throw off any progress and even sometimes have backward steps. But let's assume that optimistic continuation of the modest progress that happened from 2013 to 14. Well, it would take a quarter century to cut poverty in half overall. And if we believe, you just saw the Ohio statistics that there's more poverty among children than in the population as a whole. That's true in the nation as well, but that's terrible. That they're our future. They should not be disproportionately poor. So we talked about how can you get children's poverty rate down to the same rate of everybody else's, and what takes 25 years overall, it would take 35 years to get child poverty down to that same rate. Well, we think that's too long. And what that tells us, since we're talking about a period where we're well out of the official recession, which officially ended in 2009, that the workings of the economy alone are not enough to lift enough people out of poverty. So we need the work of governments at all levels, the federal government most certainly, and state governments too. And as Hannah mentioned, yes, effective public programs do work. The Census Bureau put out estimates. Some of the programs that are most effective aren't counted in the official poverty measure. So they did alternative measures that took those programs into account. They found that refundable tax credits, earned income tax credit, and the child tax credit lift about 10 million people out of poverty, and that includes 5 million children. Housing subsidies lift 2.8 million people out of poverty. And so the Ohio statistic for the tax credits, 289,000 people in Ohio alone, 162,000 children. So that's very important. So alone, as I said, the economy doesn't do enough for us. And the data that was part of the census release at the end of September was illustrative and confirms many other sources of data. The top 5%, their average incomes rose very considerably, and we're just looking from 2010 out of the recession to 2014. Their incomes rose from $325,000 on average to $346,000. These are all in 2014 dollars, so it takes inflation into account. But the bottom fifth, whose incomes are pretty low, as you see, their average incomes dropped from about $12,300 to $11,900. That's very bad news. So another way of looking at it is, let's say we took steps to increase the number of programs that we know are effective, try other things, and we were able to get cut the number of poor people in half by 2020 instead of taking a quarter century. We'd have 22 million fewer poor people, but only 2 million fewer poor people if we keep on at the same rate. So if we take action, that's a $20 million people difference. So why do we care so much about it? I have a feeling I don't have to convince any of you, but we know that poverty has a very, very high cost, that if children have certain benefits, they do better. And examples where there's real evidence of better outcomes for children: Head Start, nutritious food, housing, health care, they all do better in terms of their ability to benefit from school, fewer health problems, better development, better able to earn as adults. And families, again, there's a lot of research evidence if they have stable jobs, secure income, they are contributing to our economy and helping all of us. On the other hand, if you take benefits away, and on the right-hand side of this slide, we cite research from Children's Health Watch, an organization that specifically looks at babies and toddlers and their families, found that after a cut in SNAP or food stamps in 2013, where benefits went down from about $1.70 per meal to about $1.40 on average, that children, those young children in these households, were more likely to be food insecure. That means not able to afford food, nutritious food at all times. And there is a direct connection that the research shows that children in those food insecure households more subject to bad health, falling behind in school. So there is a real cost to reductions like that. But instead of building on that and expanding and improving upon the programs that we know can help, we've had a long term reduction in all kinds of programs that would be helpful. So you can see from fiscal years 10 through 15, not even counting deeper sequester cuts that I'll say more about in a second, that there were these substantial reductions in programs that are important in reducing poverty and giving people opportunities. All of those are changes taking inflation into account. Then in 2013, we did have those deeper cuts that are known as sequestration. At that time in 2013, actually there were about 100,000 rental vouchers lost. Then we did better, but we didn't undo all of them, so there are still between 67,000 and 70,000 rental vouchers still lost as a result of that sequestration. In 2013, we lost 57,000 Head Start slots. That's kids that weren't able to be in Head Start. Most of those have been restored, and about 5 million meals to homebound seniors, or not just either seniors or those going to congregate places to get meals. About 5 million of those meals were lost because of sequestration, not delivered. And I told you about that SNAP cut. Well, that is the wrong direction. We also know that under Congress's proposed budget, its outlined plan, they would have allowed, or they still might if we don't fix this, millions of people, 16 million people, 8 million children, would lose the improvements that had been enacted for those low-income tax credits, plunging them into or deeper into poverty. And right now, I think we have what we hope will be better news, but if the appropriations bills that were partly passed by Congress took effect, instead of getting back those 67 or 70,000 housing vouchers, those would still stay lost, and we could perhaps have lost another 50,000. But there is better news. And this was the example of the high end of voucher cuts in Ohio. If the proposals took effect. So here we were scared because it was looking like the debt ceiling would be breached, that the Treasury wouldn't be able to borrow anymore with catastrophic impacts, and the temporary spending. Who knows what was going to happen to that? So we had our kind of nasty little Halloween guy there, and we were urging people to holler about it and say, Congress, stop scaring us. But this slide was developed in the middle of the night. The other night, Congress did come up with a deal, which they filed midnight. Was it Monday night? And so I was pulling an all-nighter and writing this slide for you. And so we know not maybe a deal, we have a deal. And the Senate hasn't voted on it yet, but I think the predictions are certainly that they will pass it. So this is, at this point, former Speaker Boehner's gift, because he was part of a bipartisan effort to fix some of the scariest aspects. So what's in this deal that the House passed yesterday and that the Senate is likely to pass probably tomorrow. The debt limit will be extended through 2017. They did not totally do away with the caps that they call the sequestration caps, but for the year that we're in now, they get rid of about 90% of the cuts for those caps. So the total is $66 billion more money in fiscal 2016, $46 billion more in 2017, evenly split between defense and domestic programs. They also fixed a problem. They did not totally get rid of an increased premium in the Medicare program, Medicare Part B, but they reduced it because it was predicted that at least a $50 a month increase would be occurring at the same time when nobody is getting Social Security benefit increases because of inflation not triggering it. So that was an important fix. And also a very important fix for Social Security disability income. Come 2017, that program was going to be cut nearly 20%. Benefits would be because of a shortfall in the program. Advocates were calling for something that rebalanced the old age security and disability parts of Social Security into the 2030s. They didn't get that, but they did get a fix that lasts through 2022, which is helpful. And they did not get benefits cuts or eligibility cuts. So on the right-hand side where I say advocates very concerned, I was emailing back and forth in the midnight to early morning hours on Monday night, and I was hearing concerns, but as people learn more about it, they are considerably reassured, although there are some things still to look at. And then I guess I couldn't help but, all through the night, reading through the 100-some-odd pages of this deal, coming at the very end to learn that the small house rotunda in the U.S. Capitol was renamed the Freedom Foyer. I just thought you'd want to know that. Don't know yet if it'll have enough support. Yes, we do. It passed very substantially with a bipartisan vote in the House, and we are expecting that in the Senate. So this is extremely good news. And it is two things important to know. Everyone who advocated, who followed our suggestions about contacting members of Congress, who put words out in various ways, who ignored us but did it in their own separate ways, it has had a very important effect. It was clear to Congress that they did not want to be on this kind of crash course to things that would range from bad to catastrophic in terms of government shutdowns and inability of the federal government to pay its bills. They also came to see that even those folks who really only wanted to raise the military spending, that they had to raise spending for domestic programs. So that's extremely important. But it also shows the limits. All that we've talked about, poverty and the need to reduce poverty, takes more of an investment than we are likely to get from this deal. There will be some improvement, some increased investments, and obviously cuts prevented because of this. But if Congress was not so resolute to minimize revenue increases as part of our solutions, we could do a lot more. And this is one example. Extra tax breaks for hedge fund managers would say, if we stop those extra breaks, it would save about $1.4 billion a year. That's about enough to cover full day, full year Head Start programs. I'm hoping, I know advocates will work to get that increase in Head Start, and maybe we will because of other revenues and offsets that were found in this deal. But multiply that by all the other needs we have, and you'll see why we need revenues to make a real difference for us. And there's hundreds of billions of dollars of tax breaks that should be examined in that light. Are they the best choices we could be making? So I guess that was it for me. So thank you very much for the work that you've done. Know that it was effective. Our next steps together are to look at how they actually divvy up the money between now and mid-December to go beyond these totals to making some of the right choices for the programs that we need, to avoid ideological riders that might gum up the works and again set us on a crisis course. This is all work that remains to be done.
Debbie, thanks so much. And we're going to turn the last piece of our presentation over to Bill Sundermeyer to take a little bit closer look at specifically what's happening in Ohio and what we can do here.
Thank you very much. Just in summary, the things I'm going to be talking about are to try to give you some insights into the status of poverty in Ohio, a little more, a little information about some of the attitudes that our citizens carry, and I would say that those attitudes are also reflected in our state legislators. I'm also going to be looking at some ways in which we might want to consider the way in which we talk about the issues related to poverty. And then also I'm going to give you a little list of some of the issues that I'm already hearing about that people want to bring to the table and involve legislators in making some decisions in 2016 and 17, and give you a little appetite to a new issue that we're working with, and that we hope we can bring more information to you about how we might be able to reframe these issues and allow us to get some more progress achieved. So with that, the first one is a map. And in this map, we see what poverty is like county by county in Ohio. And of the 88 counties, we have 9 counties that are in blue, which means that the poverty rate is somewhere between roughly 5% and 9%. The most significant and most highest percentages are those counties in the red, which are 20% to 31%. If you look closely, and for instance, if you looked at the very top where the red county is. That's Lucas County, and you'll notice there's a little star there. And if, as you get these, you can download them and blow them up a little bit on your computer, and you can see where those stars are located. Those stars have a significance. Each of those stars represents a member of the legislature or more than one member of the legislature that resides in that county and has a responsibility to the constituents in those counties to deal with the poverty issue. But you will notice there is only one county out of those 9 that are in the blue that has less than 9.3%, or excuse me, yes, 9.9% poverty, and that's in Medina County. But the overwhelming leadership of both political parties in the state legislature currently reside in those counties where it is somewhere between 16% and 31.7%, which means our message is not getting through very well. So we're going to talk about that a little more. Look at another map. One of the things that we were able to achieve in this last legislative session was that we were going to tackle the issue of 16 to 24-year-olds who live in poverty and what we can do to bring assistance to them and how they can be helped. I've also placed those stars there, and you can see that the lightest blue, to give you an example, it would be like Lake County and Geauga County would be 2 of the lighter blues, where there's the least amount of children or young people living in poverty in the county, and the most significant and only one, dark, which has between, and it amazed me when I read this number, 38 to 65% of the students of the people in Athens County are in poverty. As an example, another one, taking another look at it from a different perspective, and we look at teen birth rates, because if you look at this issue and you read things about the whole issue of poverty and what are some of the factors related to it, teen birth rates have an impact as well. And you will see that the number or percentage of people who are female and between the ages of 15 and 19 in the Deep South are 48.8% to 61.1% of the females ages 15 to 19 in those counties who are giving birth to children. That's another way, and that's another problem, and that's another aspect of this issue which we need to wrestle with. And again, you see in those darker counties, with rare exception, it is very high in terms of a teen birth rate. And lastly, and I don't have one for other than the African American, and there may be some maps out there, but I could not find them. You can see where the percentage of African American population exceeds 10%, and you will also notice there are a lot of stars in those red counties. That gives you some flavor for that whole issue, but let me give you a little more background data. This is a new chart that was put together by Policy Matters, and that we are in the process of preparing. We'll put it online. We'll have some copies available for people, but it shows the wages and the numbers of people that are employed in certain occupations, and the most important column, in my opinion, is the one to the far right. Because if you look at the poverty level for 2015, you do not hit the 138% for Medicare assistance, for example, until you are in that bottom 3, and the only one that is above 200% of those occupations that are listed goes above 200%. Overall, what we have created in many instances is more and more low-paying jobs, and what we do and how we wrestle with that issue is a part of this problem that people are going to be talking about. Let's look a little closer at some of the attitudes. This is a survey that was done by the Pew Research Center, and the last data that's available is for 2014. But I selected some that I thought were most significant for the topic that we're talking about. And for instance, in 2014, when polled, would you agree with the statement, government is almost always wasteful and inefficient, or government often does a better job than people give it credit? 56% say that government is almost always wasteful and inefficient. The next one, poor people today have it easy because they can get government benefits without doing anything in return, or poor people have hard lives because government benefits don't go far enough to help them. And since 2013, when that issue was equal, we have managed to move it to 47%, but I would note it's not over 50%. It's only at 47. And it could fluctuate because what happened in 14 versus 13 is you see the didn't answer dropped from 14 to 9%. Going forward again, the government should do more to help needy Americans, even if it means going deeper into debt. Or the government today can't afford to do much more to help the needy, and 51% are of that opinion. And the last one as well, racial discrimination is the main reason why black people can't get ahead these days. Or black people who can't get ahead in this country are mostly responsible for their own condition. And I would suggest to you that in looking at all of the questions, this was one of the highest attitudes that exists in their research. And that is going to be a problem, and it is a problem, and it is sometimes very difficult to get that issue on the table. I'd like for you to take and listen to these two statements. This is the first one. In a weak economy, the working poor have to take any job they can get. Imagine the plight of a single mother working a low-wage job. Even at $10 an hour, she owns only about $20,000 per year with few benefits like health care and paid leave. Who could support a family on $20,000 a year? The working poor frequently need to choose between buying food and paying rent. We need to ask our government officials to find a way to address these problems and help the most vulnerable. That's one way of putting this issue. Here's another. The nation is relying too heavily on low-wage service sector jobs from national companies without insisting that they pay workers good wages and benefits. Creating prosperity tomorrow requires responsible planning today. Too many companies and decision makers focus on the short-term profits and short-term thinking to the detriment of our workforce, and when we allow one part of the workforce to weaken and struggle, it weighs down the economy for all of us, resulting in a lower standard of living. Our nation needs to change its short-term thinking and start building good-paying jobs with benefits and a strong economy for the long term. With better planning, we can repair the nation's economic engine and create a future with a strong economy and good-paying jobs for our workers. We are in the process of building a relationship with a group called Frameworks. And what they find is we need to change the way in which we start many of our conversations that we have with legislators, with community leaders, with our neighbors, and get people to start thinking about this as a problem for the community as they view it, and less of a problem as we have historically described it. I've included a little form and quickly asking you which way to consider this. Let's look at the next one. And here are some of the ways in which we can look at this differently. For instance, the one that frameworks would suggest is the issues of the economy, jobs, and future of prosperity versus the issues of poverty, the poor, and the working poor, et cetera, et cetera. Take a look at these as you look at the slides later. Give some thought to it, as well as looking at the next one, which, did I miss it? I did. Excuse me. These are some of the words we should and should not use, and it's interesting to me, when you talk to the people at Frameworks and others, they suggest don't use the word poverty, and yet we have done it. We're used to using it, and we need to think that through and make some additional decisions in the future. A couple more things. Here are some of the issues that I hear that are being talked about, and some of these are things that we in AOF will be taking action. Our steering committee will be considering them and making decisions as to whether or not we will actively be involved in the successful creation of those issues. They are creating jobs, raising wages, improving the EITC, support for pay equity, provide leave pay and paid sick days, establish work schedules that work, invest in affordable, high-quality child care and early education, and build strong, accessible health care and behavioral health care systems. And the last page that I put forward is one of the things that I ask you to take away from at least my portion of the conversation is to start thinking about that if you were going to be talking to a state senator on Tuesday morning of next week, how would you talk about those issues? Would you explain them and talk about it from the impact that it has on the economy and on the society in which we live? Or would we be talking about it from the perspective of its impact on that individual? Keep in mind those percentages and the attitudes that exist today in people's minds across the state. I thank you very much. And at this time, we'll turn it back to Gail for a wrap-up. Gail, go forward.
All right. So we are about to step into the question and answer portion, but we don't want to leave you today without giving you some idea of where to go next. So in looking at how we affect poverty at a national level and at a state level, and Deborah did a really great job of emphasizing this, what we would recommend is if you want to help move these issues forward, be someone who responds to those calls for action. We know that phone calls to legislators, the emails that they get, names on petitions, all make a big impact in helping them understand how important issues are to their constituents, how important they are in the sort of the public opinion, and how much it matters that they act one way or another in placing their votes, in deciding on amendments and legislation. And so I've given you here just a couple of ways of connecting with Advocates for Ohio's Future, with Policy Matters, and the Coalition on Human Needs. Those links are actually live. If you wanted to click one, you would have a tab that you could start following on Facebook or on Twitter, some of these organizations that are putting out opportunities to impact poverty on a regular basis, because we know it can get complicated and a little bit exhausting to have to follow all the issues on your own. But fortunately, there are a lot of groups out there who are keeping close watch. The last thing that we'll do today is actually to open up the floor for questions and answers, and I do have a list of some of the questions that have come out through our chat bar. So just 1 second, and I will set us up for questions and answers.
All attendees are muted and may unmute themselves by pressing *6.
So if you'd like to ask a question for Hannah, Debbie, or Bill, you're welcome to press *6, unmute, and go ahead and toss that out there. If you'd like to just add your question to the chat bar, we can bring it into the conversation that way. And I'll actually get us started by going back to a question that's come out of the chat early on, and that was that Governor Kasich and also others like President Obama have touted large improvements to the economy in the last few years and really have focused on, recovery since the recession. Our speakers, and maybe I'll start with you, Debbie, do you feel like that there have been a lot of improvements to the economy, or how do you respond to claims like that when you look at these programs?
Well, there have been improvements to the economy as a whole. It shows up in gross domestic product. It shows up in jobs created. But what some of the data also shows is that prosperity has been largely unshared. In the last year, there was a little more sharing, but we really have not managed to get benefits or advances to most people in our economy. The people at the top 1% or 5%, and even fraction of a percent are the ones who have gotten almost all the gains, certainly through 2013. And then 2014, there might have been a little bit more progress for people, say, at median income and below. But we did still see, if you looked at the slide, and I'm not going to try to scroll back to the slide, but there was a slide that showed the top 5% made considerable gains between 2010 through 14, whereas the people at the bottom, whose incomes are at the $11,000-$12,000 range, they lost ground during that point. So the big challenge we face is to make prosperity shared.
Thanks, Debbie. Hannah, I want to toss a question to you that came out, and that is, when we're talking about poverty and who is in poverty, how is that measured, and is that measure meaningful to advocates? What do we do with it?
So the census uses a set of poverty thresholds, and I've added a link into the chat bar if people want to see that table. For 2014, it was about $24,230 for a family of four, and less depending on your family size. And that only measures gross pre-tax cash, the official census poverty measure. Now, we know that that's not necessarily all the kinds of incomes and supports that people receive, so the census does put out a supplemental poverty measure that includes some tax payments, accounts for some work expenses, sort of factors in a more robust, a more reality-based sort of measure of what it takes to sort of make it in today's sort of actual in the actual sort of consumer reality of where we are. So that's the supplemental poverty measure, and those are both available on the census website. The supplemental measure is for national data only at this point, the update is, but you can still read the reports and get a sense of where we are sort of at a national level. And a lot of those figures for how much does SNAP keep folks out of poverty, how much does the EITC help, those measures come from the supplemental poverty measure, many of them. And just to kind of on the first question of whether, is Ohio doing well, I think, nationally, the nation and the majority of states recovered or sort of officially broke even. They recaptured the number of jobs that they lost to the recession back in 2014. So that's the nation hit that point in 2014. Most other states hit that point in 2014. Ohio still hasn't. We still need more than 18,000 jobs just to break even. So that doesn't include the number of jobs we would need to keep pace with population growth over that time. So we still haven't met the most basic threshold of recovery. and then if you look back over the last 12 months, Ohio's job growth rate has been 0.9%. The national average is 2%. So I think part of the question that was asked was, are our state policies doing what they said that they were going to do? So in the current administration, and really since 2005 in Ohio, a lot of our state budgetary policy has been premised on this idea that if we just cut taxes and we reduce state spending or state investment to enable us to cut taxes, then we're going to have more robust job growth. And the data just doesn't seem to support that. We've had below average job growth for many, many months. I think we're up to 36 months at this point. We are well into the recovery, more than 6 years, and we still haven't hit this basic threshold. And that's aside from those sort of fairness factors that Debbie mentioned, that, is the recovery being broadly shared? Is this really a recovery that not just the top 10% are participating in? So the idea that I think we hear Ohio talked about as being a remarkable, sort of a miraculous economy, but in context, I think there's good cause to question that, and certainly good cause to question that when we see things like more people working, people getting higher levels of education, and not seeing that being returned in terms of bringing down the poverty rate or increasing median income for the state.
All right, thanks so much for that. I want to, again, open it up for more questions. You can press *6 to unmute yourself, or if you're listening through your computer, there is an unmute button on the top middle of your screen. You should be able to open up your audio. Anyone like to add a question to our conversation?
I would, please.
Go ahead.
This is Jim Pelfrey, and I guess my question, just put simply, is it the position that minimum wage is supposed to get people out of the poverty level, or how do we respond to that? If most of our jobs are minimum wage, they've not been raised, and then the counter to that as well, then they just need to get a second job.
Well, this is Debbie, and I can start. I'm sure everybody has something to say about that. Certainly, the minimum wage hasn't kept pace with increases in the cost of living. It's gone way backward in terms of its percentage of median wages. So it certainly would get more people out of poverty if it were increased. And that absolutely needs to be part of the solution. Beyond that, we do need a kind of a family policy in this country, recognizing that if you have parents trying to raise children, a minimum wage income just doesn't cut it, and especially if it's a single parent. And the answer should not be people trying to just put more and more hours. And it bears mentioning that people often can't get the full-time work that they want in this economy too. So even if the minimum wage goes up, but you can't get full-time hours, that's going to keep some people below the poverty line. So you do need a combination of increase in wages, of recognition that the additional supports of the refundable tax credits, for instance, make a huge difference towards getting families with children out of poverty. So we need more than one solution.
I have a question. Can you hear me?
Yes.
Oh, okay. It's Fran Gafford from Cincinnati Jewish Family Service. I was the one that asked about the Affordable Care Act repeal of the auto enrollment. We do enrollment here with Enroll America. So what that sounds like doesn't sound like a good thing. Can Debbie explain what that is, Deborah?
Only marginally.
Okay.
The one thing that I do know that this particular requirement that was a savings in the budget deal that's on the way to passing was a requirement in the law that businesses, companies with more than 200 employees would have to put in place an automatic enrollment into health plans. It has not yet gone into effect. There have been problems with it, and so we are not getting rid of something that is now a requirement. And so, there's no question, there's evidence that automatic enrollment in things like pension plans increases the number of people who participate. That seems kind of obvious. It's a little more complicated when it comes to health plans because some people get health insurance from their spouse, for instance, or from another place of employment. It's not as cut and dried, yes, no, and that some of those complexities were delaying its implementation. So I know that people would rather see more automatic enrollment, but at least we can say this is not stopping something that is already in place.
Thank you.
Thanks, Fran. All right, since we are just past 3 o'clock, I'm going to go ahead and wrap up our webinar. Thank you again to our speakers for your partnership with us, and for all of you who've joined the webinar with us today. Thanks so much for paying attention to these issues, and I hope you'll continue to watch and engage with us as we try to affect poverty both at the national and the state level in Ohio. I'll wrap up by sending us to a survey. Just let us know how you felt things went today. We do look at these and try to incorporate feedback so that we are giving you information that's helpful to you. So thanks again, and we hope that you'll join us in the future for another webinar with Advocates for Ohio's Future.